Assalamu alaikum. My name is Dr. Anwar Farooq. Today we will be talk about miscarriage. This video is specially for the females. What is the miscarriage? Types of the miscarriage, symptoms of the miscarriage, causes of the miscarriage, maternal health condition during miscarriage. What does not cause miscarriage? Prevention of the miscarriage, diagnosis of the miscarriage, treatment of the miscarriage. What is the miscarriage? Miscarriage is a spontaneous loss of a pregnancy before the 20th week. About 10 to 20% of non-pregnancy end in miscarriage. Symptoms of the miscarriage. Most miscarriages occur before the 12th week of the pregnancy. Signs and symptoms of the miscarriage might include vaginal spotting or bleeding, pain or cramping in lower abdomen or lower back, fluid or tissue passing from your vagina. If you have passed fetal tissue from your vagina, place it in a clean container and bring it to your health care provider or hospital for analysis. Remember, most women who have vaginal spotting or bleeding in the first trimester go on to have successful pregnancies. Causes of the miscarriage. About 50% of the miscarriages are associated with extra or missing chromosomes. Most often, chromosome problems result from errors that occur by chance as the embryo divided and grows. No, not problem inherited from the parents. Chromosome problems might lead to the belated ovum. Belated ovum occurs when no embryo forms. Intrauterine fetal demise. In this, an embryo forms but stops developing and dies before any symptoms of the pregnancy loss occur. Molar pregnancy and partial molar pregnancy. With the molar pregnancy, both sets of the chromosome come from the father. A molar pregnancy is associated with abnormal growth of the placenta. There is usually no fetal development. A partial molar pregnancy occurs when the mother's chromosomes remain but the father's provides two sets of the chromosome. A partial molar pregnancy is usually associated with abnormalities of the placenta and abnormal fetus. Molar and partial molar pregnancies are not viable pregnancies. Molar and partial molar pregnancies can sometimes be associated with cancerous changes of the placenta. Mental health condition during miscarriages. Uncontrolled diabetes, infections, hormonal problem, uterus or cervix problem, thyroid disease. What doesn't cause miscarriage? Exercise including high intensity activities such as jogging and cycling. Sexual intercourse, working, provided you are not exposed to harmful chemical or radiation. Talk with your doctor if you are concerned about work-related risk factor of miscarriages. Age. Women older than age 35 have a higher risk of the miscarriage than do younger women. At age 35, you have 20% risk. At age 40, the risk is about 40%, and at age 45, it is about 80%. Previous miscarriages. Women who have had two or more consecutive miscarriages are at higher risk of the miscarriages. Uterine or cervical problem, certain uterine condition, or weak cervical tissue, or incompetent cervix might increase the risk of the miscarriage. Smoking, alcohol, and illicit drugs. Women who have smoking a greater risk of the miscarriage. Having alcohol use and illicit drug use also increase the risk of miscarriage. Weight, being underweight or being overweight has been linked with an increased risk of the miscarriage. Invasive prenatal tests. Some invasive prenatal genetic tests such as chronic villus sampling and amniocentesis carries a slight risk of the miscarriage. Complication of the miscarriage. Women with septic miscarriage, fever, chills, lower abdomen tenderness, foul smelling vagina discharge. Prevention of the miscarriage. Seek regular prenatal care. Avoid non-miscarriage like risk factors such as smoking, drinking alcohol and illicit drug use. Take a daily multivitamins. Limit your coffee intake. Diagnosis of the miscarriage. Pelvic examination, ultrasound, blood test, tissue test, chromosomal test. And in the last, treatment in homeopathy. Aconite, Epicock, Viburnum, Trillium, Arnica, Chamomilla, Subina, Calcarea fas, Califas, Calcarea flor. Thanks for watching. Please like and share this video. Thank you very much.